Hello, everyone, and thank you for joining us, whether it's afternoon, evening, or the middle of the night. It's a pleasure for us to be with you here virtually. I'm Dr. Jennifer Blake. I'm the CEO of the Society of Obstetricians and Gynecologists of Canada, the SOGC, and I want to welcome you to our first live session discussing pregnancy during COVID-19. This episode is brought to you with the help of a partner of ours, First Response, who is a leader in pregnancy support and one of the first products that actually SOGC recognized in our brand recognition program. And we're very grateful for their support this evening. We're hosting this interactive session because we know and we hear that women are really struggling to find accurate information. And we know that there's a lot of anxiety. It's tough enough to be pregnant with all the questions that come with pregnancy, but pregnancy in the time of COVID is quite a challenge that no one would have expected. So we're very pleased to have assembled a panel to help you with the questions that you might have. These are two leaders within the SOGC, and I'm going to introduce them in turn and let them introduce themselves. First, I'm going to introduce Dr. Bill Eamonn. And Bill, how would you like to?
Thank you so much, Jennifer. I'm a family doctor in Nanaimo. I've been practicing, it doesn't look like it, but 42 years. And I'm chair of the Maternity and Newborn Care Program Committee at the College of Family Physicians, representing family doctors in Canada who provide maternity care. It's great to be here.
Thank you. And our other expert is Dr. Vanessa Polican. Vanessa.
Thank you so much for inviting me. So my name is Dr. Vanessa Polican, and I'm an obstetrician gynecologist out of Winnipeg, Manitoba. I have an area of interest of reproductive infectious diseases, and I chair the SOGC's, I co-chair the SOGC's Infectious Disease Committee, and I'm very happy to be here tonight.
And if you go on the SOGC website, we have COVID resources, and Dr. Polican and her committee have written a great deal of those, and actually a lot of our other pregnancy resources, Bill Eamonn's name is all over those. They're two very trustworthy experts to help you with your questions tonight. So if you do have questions, we are going to start with a little brief overview on where we are in Canada with COVID-19. So be thinking about your questions. You can type them in and we will answer as many questions as we can get to this evening. If it's a question that's going to take a little bit more time or work, we don't have a good answer for you, we will make sure that we get an answer and we'll post those answers on the SOGC website. So don't hold back. If you have a question, please let us know. So Vanessa, can you tell us what's going on in Canada with COVID-19? What's going on in the world? Are we coming out of it?
Sure. So, I mean, it's been quite a year so far, 2020, since the end of December 2019. We have over 7 million cases of COVID that have been reported across the world. And in Canada, over 95,000. Among those cases across the world, we know that there have been pregnant women, and over 600 cases have been reported in the world literature about pregnancies affected by COVID, and we're quite sure that there are many more than that, pregnant women that have been infected by this virus. In terms of where we are in terms of our curves and how well we're doing flattening out those curves, in many areas across Canada, we are seeing that curve flatten out. In some metropolitan areas, the curve is slowly starting to reach that tipping point into flattening out. And I just want to thank all the Canadians that we have viewing. Really, as physicians, we have to thank you for all the effort that you're putting in to social distancing, to staying home, because the reason why those curves are flattening out are largely because of the choices that you are making. So thank you.
I'm certainly hearing that pregnant women are very motivated to make those choices to protect themselves and their baby. And the burning question that comes up is it what happens if I get COVID? What will it do to me and my baby? Who would like to take that one?
I mean, I can speak to that because I think it's the biggest question we get. Is it safe for my baby and myself at any stage in pregnancy, or should I plan a pregnancy? And I think the first thing I want to say is that I have never seen in my years of practice a more passion for caregivers to be update on this issue. And I think all of us who care about this, and especially for those people at risk, and including pregnant women, that we do try to keep up to date. And whether you say an obstetrician, family doctor, midwife, we are all doing that. So, but when it comes to pregnancy, I think you should, rejoice and be careful in your own pregnancy. I don't think the basic principles of care have changed. I think modification of maybe where you go, social distancing, as we mentioned, washing your hands, keeping your bubble close. But the bottom line is that we have seen very few significant problems in pregnancy or in the babies. And that's the best thing to know about, is that it's very safe in Canada right now to have pregnancy and have your baby.
I think that's a really good point, Bill, because when we went through, well, every year we come through influenza season, and we always encourage women to get their flu shot because we know that flu affects you more severely when you're pregnant. Vanessa, is that true for COVID-19?
Yeah, so it's a great question, because when the WHO declared this a pandemic, all we had to rely upon was the data that we knew about the flu in pregnancy, H1N1 in pregnancy, SARS in pregnancy. And we know that women, when they're pregnant, because of physiologic changes in their respiratory system, oftentimes tend to do a little bit worse than their non-pregnant counterparts when they have respiratory infections like influenza. What's interesting now, what we know about COVID, and there are many more cases of COVID-19 in pregnancy reported than there were for SARS, is that it doesn't look like it's the same story for COVID-19 in pregnancy. It seems that pregnant women have the same chance of becoming infected and have the same chance of becoming severely affected by COVID-19. And the vast majority of pregnant women, above 85%, have mild to moderate symptoms if they become infected with COVID-19. And this is, we need to keep in mind that a pregnant woman, just like a non-pregnant woman, can have medical complications that put her at increased risk of having severe disease. So if she has underlying respiratory conditions and things like that. And that's something I would encourage women to talk to their OBGYNs about, or their midwives or their family physicians, whoever's looking after their prenatal care, is asking the question as to whether they have any predisposing factors for having a more severe course.
Right. So, Bill, you pointed out the importance of social distancing, hand washing. I think we would say making sure that you have a mask handy for you if you're in an area where you can't be socially distanced. All those precautions are doubly important now, because you're protecting yourself and your baby. But we've just had a question come in from Terry. And I think this is a question that concerns lots of people now whose work takes them into situations at risk. And Terry asks, what about the safety for working hospital nurse?
This is a great question, and we're getting it. I think all of us are getting this quite often. And I think that we know that every place has to be individualized. It has to be on the basis of what is the risk in your current occupation. What is your ability to provide the protective gear that is important, and personal protective gear, including the masks and the appropriate clothes. But every hospital, every institution that is providing care has incredibly strong rules for caregivers. And if you're a person who's pregnant and you have other issues that make it more difficult for you or potentially more at risk, then that's a whole different world. And I think you need to talk about it with your caregiver. The other thing is that each person is different, and every person should be assessed and discuss it with their caregiver based on other issues of fear of their family, of the contact, in addition to not just the pregnancy. But it is a personalized decision, and it is safe if, just like anyone else who's working there, if you're using the right safety equipment and washing your hands and doing other things that we recommend.
And Vanessa, in our statement, we would certainly recommend that if you have the choice of being assigned to non-COVID work within that hospital, that you would, that would be another precaution that your hospital could be taking on your behalf, is that? Or
yeah, so, as you're both saying, every job and every individual needs to be assessed individually, because nobody is the same and no job is the same. And that is true as we work through this pandemic too, as the burden of virus within our community changes. The risk of encountering a virus in the workplace changes too. So it's something that I would not only individualize, but also encourage people to reassess with their prenatal care providers on an ongoing basis.
yes, and we've got I think it's Amanda that's saying, well, our guidance is a little different from what the Royal College is saying, and I can tell you that yes, we do see differences, and when we see those differences, we actually have called up the Royal College and talked to them about, why they've made certain recommendations, and we've talked to our colleagues in the States and in other countries. So everyone is trying to get the best information to put together the best advice. And the situation, as Vanessa said, is constantly changing as the risk of exposure changes, as the numbers change in a community. So I think that in this one, the answer is, we certainly don't want pregnant women to get COVID. We don't want anyone to get COVID. So, but the usual precautions are the same precautions. It's the hand washing, it's the distancing. Talk to your occupational health group about what's going on in your hospital and what the precautions are. They should have adequate PPE for you. They should have proper training. And it's really important that there's no slippage in those areas of protection for you. And then your own situation is your own situation, and that's between you and your care provider. And we can't tell any one person what's best for them, but we can reassure you that the precautions will work.
Jenny, I'm just also noticing that Jessica's actually asked a question about personal protective equipment while she's pregnant at work. So if you're okay, I'm just going to go ahead and answer that question. So and Jessica says that she's a dental hygienist, and she's going to be wearing an N95 all day while she's at work. And she wanted to know if there was any effects of having an N95 on all day. And certainly there have been studies that have looked at this, not very many, but of the studies that we do have, there is no evidence that wearing an N95 for a prolonged period changes anything about the amount of oxygen that goes through the placenta, and we have no evidence that it has any detrimental effects on the baby. What is important to know about wearing an N95 in pregnancy is that when you are going through pregnancy, your body changes, and part of your body is your face. And so it is important, especially in the third trimester, or if you've had any major changes to your weight or are experiencing swelling, things like that, to have your N95 refitted as you move through pregnancy in case the shape of your face has changed.
Right. We've had a number of questions about can the baby get COVID? And there's been different reports coming out in the news. What would you say to that?
Sure. So at this point in time, as I mentioned, we have in the world literature, in the world medical literature, we have over 600 cases of pregnancies where there has been a COVID infection that have been reported. And about 45% of those have delivered or had delivered at the time that they were published. And so of the cases that have delivered, about 70% have been tested. The babies have been tested in some way, shape, or form for COVID after birth. And in the vast majority of cases, 90%, the babies are born with no evidence of COVID. They're born COVID-free. That being said, in a small number of case series, there has been some sort of non-negative testing. And when you go through and you look at each case, there may be indications that there is a positive test, and there may be problems with some of the tests that have been used. So at this point in time, there's kind of anecdotal evidence that that we need to keep following, that in exceptional circumstances, sometimes when a mother is critically ill, sometimes when there's been immunocompromised, could there be what we call vertical transmission, passing the virus from mother to her fetus? Possibly. But at this point in time, we don't have any substantial evidence that this is definitive and certainly not common. If anything, it seems to be exceptionally rare.
And the good news is that the babies seem to recover very rapidly.
Absolutely.
So a related question, and perhaps Bill, you'd like this one, or maybe you'd both like it, is in the more common situation, you have COVID, you've given birth, you're not actually all that sick. Can you breastfeed your baby?
That's a great question. And it's reassuring to know that because the baby is often free, and we don't, we're learning a lot more, but the recommendations from Canadian experts in the Pediatric Society is that it is safe to breastfeed. There are some common sense approaches to that. If the mother is coughing and sneezing, obviously some hygiene of the breast is important. But the mother should be wearing personal protective equipment, mask, but the baby breastfeeding is important. We think that is overwhelms any potential small risks. So yes, and the staff that supports you after birth will support you in the process of that very carefully.
Yeah, agreed on that, Vanessa?
Yes, yeah. Big green light.
Yes, and that question, I want to just say thank you to Millie, who's an influencer who is joining us tonight. And thanks to you, Millie, for the work that you're doing on trying to get information out to the many women who are following you. This is really an important point. Mothers and babies need to be together, and you're going to be going home and living in the same home together. You will be together after you've had your baby. Alex is asking, this is I don't know who's going to want this one. What Alex asks, what's your regarding sending your toddler back to a daycare center once they reopen if you're pregnant but have no underlying condition? All right.
I can try to tackle that one. It's, Alex, it's a great question. And as so many things that are COVID, I wish that I had a simple yes or no, and I'm afraid that I don't in this case. I'm glad that you're already identifying that not every pregnant woman is the same, and that certainly a woman that has underlying health concerns that might put her at increased risk of having a severe infection might have a different solution than somebody who has no underlying health conditions. But the other moving pieces in all of this are, what is your local burden of infection? How much community transmission is going on? What kinds of measures are in place at your daycare? Are we talking about a large center? Or are we talking about a home daycare with a few other people? So I would really encourage you to kind of look at your individual situation. And if you have concerns that the situation is set up so that there might not be, respective rules to not come in when a toddler is sick, or no ability to social distance, or not a lot of good hand hygiene practices, that might be something to be aware of. But I think a lot of daycares and a lot of schools right now are doing their utmost, just like we are in hospitals, to really make sure that we've dotted all of our I's and crossed all of our T's to make sure we're minimizing any type of community transmission as best as possible. But certainly when it comes to toddlers, it is a challenge. Yeah.
So I think that leads very naturally into a very common question, which is it safe for me to go to hospital? And when should I go to hospital? Who would like that one?
That's something that's asked by my patients all the time. And I say that when you feel it would be normal for you to go to hospital before the COVID episode, is that hospitals are set up for looking after you at the stage of pregnancy or labor that you're in. And you're not going to stay longer if you don't need to, if it's early in your labor, but it's safe. They are exceptionally careful in all the perinatal units about protection. And you'll find that the care you receive is the same as if it was before COVID, except everybody's more careful. They're wearing masks and headgear and other things, which actually it isn't threatening once you sort of get used to it. Can I just make one point about the toddlers? For some reason, we know that children don't seem to be affected by this virus as much. And maybe it's something about their immune system or something. And we know for sure that if you're asymptomatic carriers, and they can be there for sure, but asymptomatic carriers in children may not be as risky as those adults. And so as Vanessa said about the daycare's questions about whether your child is sick, and the appropriate hygiene that's provided. I think that's a very reassuring thing for daycares if they do it properly.
Now, there's a question here that Tara has asked, and actually, Tara, we were chatting about this one amongst ourselves before we went live, and that is, what are the recommendations for visitors once your baby arrives?
This one's a tough one because, you know, a baby coming into this world is such an exciting time, and there are family and friends that have been waiting months to meet this baby and this little one. And I would really say that as much as we're starting to see this curve level off in many parts of the country, you know, this is a time in our history to really, you know, for moms and dads and to really kind of hunker down with their baby at home and really try to evaluate who is important to be seen in these early stages of this baby's life. You know, somebody who might be lending support, like a grandmother, who's really kind of needed for a mother and a father's or a parent's mental health to help support, and that should not be diminished. The fact that we do need help when we have a newborn at home. That being said, this is probably not the time to have a big baby shower with lots of invitees over. And I would really encourage the use of, you know, all the great technology that we have to introduce babies online, and also make use of the good weather that we have right now, because it's easier to social distance if we're going for a walk in the park, you know, 2 meters apart with our babies in a carriage, than it is if we're hanging out at a coffee shop, for instance. So, and as Bill has said, you know, the best measures are to ensure good hand hygiene, to ensure that we can maintain social distancing. And I think it's reasonable to be protective of our newborn babies.
Yeah, and I think that most of the grandparents they're also very concerned for their own health. And so they're going to be extremely observant as a general rule of all of those measures that keep you safe. I want to take the next one, and that's a question about, can my husband or my partner come with me into labor and delivery? And this is one that we've taken a very strong position on as a society, because we don't see your partner, your person you've chosen to be with you when you're giving birth as a visitor. That is a person who's a really important part of your support team. There was a situation in 1 or 2 hospitals where they, at the height of the surge, where they simply couldn't cope. And I think that caught a lot of publicity. But I think hospitals across the country have really worked hard to ensure that you can have that person with you when you're in labor. Now, you need to check with your individual hospital. Some hospitals have very specific restrictions, and so you'll want to know those in advance. And those, whoever's looking after you in your pregnancy will know those rules and can let you know. The person who comes with you will need to wear a mask. They will need to be screened. They will need to practice hand hygiene. And they are probably going to be told that once they've come in with you, they're not going anywhere. They're not going to be going out to get a pizza run. They're not going to be going to Tim's for you. They're going to be there for the duration. So please come prepared. And it won't be a tag team. In almost every hospital that I've heard of, you've got one person who can come with you, and that will be your person. And Bill and Vanessa, do you want to add in on that?
I think that we're going to see some, as this process changes, we're going to see changes among local institutions. Some in places where it's very low have just changed and allowed another one designated other person. But it's going to change and evolve as the process. And the one thing about COVID is that whatever we say now may change in a week. So please speak to your care providers, and find out what your local resources are, and know that whatever is being done is done for the reasons of protecting you, your baby, and your family.
Yeah.
That I can't say strong enough.
Yeah, I don't think there's ever been a time when we have paid so much attention to the care as a society, to the safety and well-being of pregnant women, and that's actually a nice change to see. So Kelly has a really important question. Is this a safe time to try and have a baby?
Yeah, such good questions tonight. And so I think it's important to remember that there are many factors that go into deciding when to start a family or when to expand a family. And medical factors are certainly one of them. In the reports that we've seen from the global literature, we have not seen any signals that there's an increased risk of first trimester problems or congenital malformations if there is infection during pregnancy. But medical factors are just one piece, right? All facets of people's lives have been affected by COVID. For some people, financial or support stability into the future is a little bit different than it was 6 months ago, and that might influence somebody's decision. And there are some things that have not changed because of COVID-19. Some patients may feel that they're coming to the end of their reproductive careers and feel under pressure to start a family. And I think that to those patients and to those individuals, I don't think that I would have them steer off that course. If they feel that this is the time in their lives to have a pregnancy, as we've kind of outlined today, the vast majority of healthy pregnant women are doing okay, even though we hope that nobody gets COVID, seem to be doing okay if they get COVID. We have no signals that this is causing major systematic problems for babies. And I think that needs to be weighed into an individual's global decision as to when to start their family.
I think one of the things that we should be clear about is that women, that this issue of anxiety, we're hearing about this. There have been some studies that have been doing that. So if this is the time that is right for you to get pregnant, or if you are surprised by a pregnancy, think about the supports that you're going to need. If you are feeling anxious, if you are feeling worried, it's understandable. And there's a lot of other women experiencing that, but make sure that you've got a support group. It could be your family, it could talk to your healthcare provider. There's nothing like company and support that you can give one another at a time like this. And the reassuring thing is that we are seeing so many women come through, have healthy pregnancies, healthy babies, coming home and enjoying their peace and quiet time with the baby. So there's actually some silver linings in this social stay-at-home time.
I see a question from Cheryl. It says, is it recommended to wear PPE with a newborn child at home once you come home from the hospital? If you're not, if you're not COVID positive, if you're not ill, and you bring your baby home, you would just keep that baby close to you, as part of your bubble, and you just care for your baby as you would normally. Absolutely. Now, that's not the same as other people, but for you, you just manage your baby as you would normally and try to get through those first few days and weeks and with the support of your partner. And that hasn't changed.
Just one thing to add, Bill, I think that many of us on our social media feeds have seen little pictures pop up of babies in baby masks. And I do want to say that one thing that we don't recommend is to use masks on babies, cloth, medical, otherwise, that has not been tested for safety. And certainly we try to avoid putting anything over a baby's face that could compromise their respiration.
For sure.
Breathing.
I think the CDC recommends nothing under the age of 2, never a mask on a child under 2.
Yeah, that's a very good note.
Thanks for mentioning that.
People tonight, and Colleen has just come through, and it's such an emerging issue. But what about the placenta? What about those studies that people have been reading in the newspaper about COVID-19 affecting the placenta?
I think you've said it the best, Jenny, is that it's an emerging issue, and we don't know the significance of these changes at this point in time. what we do know is the clinical outcomes that we've been seeing, and for the vast majority of babies that are born to moms that have COVID-19, babies are being born at term, generally speaking, and healthy. So, you know, when we start to look for differences, sometimes we find them and we don't know how to interpret them. And I think that's the stage that we're at. We're going to keep looking. We're going to keep assessing placentas and try to link it with clinical outcomes. But the answer is that we just don't know yet, and we have a lot to learn.
Yeah, and there is actually research going on in Canada on that very subject to say, do these changes mean anything at all? So we don't have an answer for that now. Hopefully we will. It may not come in time for anyone who's on this call tonight, but hopefully we will have an answer to that. Here's a question that's come through, and I think this is a very relevant question, and I'm sure both of you get this question. Is there anything I should be adjusting in my diet? Is there anything I can do to boost my immunity? What are the things that are going to help me be healthy and fight off this or any other infection? I'm kind of adding words to what you've said, Annie, but I think that it does apply to many infections and our mysterious immune system. Can we boost it?
Mm-hmm.
You know, people ask about diets, of course, when they're pregnant and what they should and shouldn't eat. And I think the absolute correct answer is you eat healthy, you know, adequate iron in your diet from whatever source you prefer, adequate calcium in your diet, especially for your first baby. And, you know, vitamins, the folic acid pre-pregnancy and up to the first 12 weeks, especially important. Other than that, you know, you just be food hygiene. And, you know, I know a lot of people are very careful when they bring food home from the grocery store, which I think is appropriate, especially certain kinds of food. And I won't get into what you have to sanitize and what you don't and how you do it, because that stuff's online. But I think that in terms of boosting immunity, I think it's looking after yourself, trying to avoid the stress that's happening in the home. I've got other children and you've dealt with that, and your partner, especially if there's been a job situation. Trying to deal with the stress, trying to eat properly, trying to get enough sleep if you can with little children. I think those are the elements that we care about. And if you can't do that, speak to your caregiver about ways of helping you with that. You know, we have resources in our community to help you, and we're seeing a lot of stress with this. A lot of people that are really just holding it together because of issues. And if you're pregnant, you get some help. You deserve it.
Vanessa, Bill, that's a great answer, a really great answer. What this was specifically, is vitamin D recommended? Is there any evidence to say vitamin D is going to protect you?
I think we're learning lots of great things about vitamin D, and we're all learning how deficient we are, and our recommended daily dose seems to be going up all the time. You know, in Canada, we know that the vast majority of us are somewhat low on our vitamin D levels. And I recommend to most patients to supplement with vitamin D during the winter more than in the summer. But I think that honestly, the biggest thing in terms of immunity is, especially when you're pregnant, getting a lot of sleep, getting the sleep you need. And that's going to do a world of good as well. Yeah.
I think one of the things that we should probably just mention here as well is that we know that when people are stressed, alcohol consumption can go up, and really important to remember that pregnancy, you do want to avoid alcohol. Alcohol is not good for your immune system. It's not good for the baby. It's not good for your pregnancy. So that is, I know there's a lot of wine culture and a wine consumption right now that you just want to steer clear of. There's a question here from a new father-to-be about working in long-term care where social distancing is just not possible.
Mm-hmm. So I think our general recommendation, and this is, you know, particularly poignant because this is in the setting of a long-term care facility, is, as a general rule of thumb, if you can't maintain social distancing, then we should be wearing PPE and wearing a mask, and again, using lots of hand hygiene. But, you know, there are concerns in that situation for the risk of bringing a virus home to a baby, but there are also risks in that situation for those who are in the long-term care home. So what I tell my patients is if you can't maintain social distancing, that is your cue that you should be wearing a mask and using copious hand hygiene.
Yeah. I'm going to quickly, there's a question here if there's any Canadian studies going on following pregnant women who've had COVID. And yes, we are, and there is a Canadian registry for COVID, and you can expect Canadian data to come out from that. And there was a nutrition question saying, should I continue my prenatal vitamins after delivery?
I think that the average prenatal vitamin is a decent vitamin to take anyway. And the other thing about it is that you never know when you're going to get pregnant again. And that covers the base. I'm sure that's not in your mind, but we do see it. I don't think it hurts. I do think, though, that it does give you a little bit of calcium. And I agree completely with vitamin D, extra vitamin D. So there's nothing wrong with staying on it. But especially if you think that there's a chance of getting pregnant in the future, it's a good idea to stay on it, I think.
Yeah. And there's more and more data that's coming out on iron and iron deficiency and the importance of making sure that you keep your iron levels up. So it's and the Canadian prenatal vitamins are all very carefully regulated for what goes into them and how they're labeled. And if I could just say, we also have the brand recognition program through the SOGC where we've looked at several manufacturers have submitted. So you can look for the SOGC logo if you're wondering which one.
Jennifer, can I make one comment about the workplace?
Yes.
I think we all should recognize that employers have a responsibility to provide a safe workplace. And I think that we shouldn't be afraid of asking for safety. And I tell my patients that if they feel that they're not being looked after, they should speak to their employer, and they do have a responsibility. And if they don't, then that needs to be looked at. And I do think most employers are aware of that. I mean, having a baby is the best thing you can do for our community, our country. You've got two people, you and the baby, to look after. So you have a right to that kind of care.
Yes, and I think it's important to say that that's not just about hospitals, that's any place that you work. It's good to see when we go into the retail shops now that they've got the plexiglass barriers, they've got the equipment available for staff. There's all kinds of ways. You shouldn't have to stand on your feet for hours at end if there's an opportunity for. So here's where I've intervened. You go to a hotel desk to check in, and there's some woman standing there heavily pregnant. And why is she on her feet when she could easily be sitting on a stool? Because the hotel wants her to be on her feet. So I've actually gone and found the manager and said, she needs to sit down. You know, it's not appropriate to worry about trivial things when we actually need to be making sure that women are comfortable and are healthy and in every way when they're pregnant.
And along with the provision of personal protective equipment, the training around personal protective equipment, how to put it on, how to take it off, all of that needs to be the onus of the employer to ensure is in place.
Yeah, and I think we all know that taking it off is one of the riskier times because by then you're often tired. It's easy to make a small mistake, and you don't want to make any mistakes with that. And this is a question that I think we touched on earlier on, but we've had a lot more people join us, so maybe important to just repeat again. Assuming that you have no underlying health conditions, and this is from Jillian, is it more likely that a pregnant woman would have a more severe case if they contract COVID-19? And the answer is?
Yeah, sure. I'm happy to go over that again. So what I was mentioning at the beginning, Jillian, is that we now have over 600 cases in the literature across the world of pregnant women that have been infected by COVID-19. And from these cases, what we've gleaned is that the vast majority of healthy pregnant women with no underlying health conditions seem to be getting the infection at the same rate as somebody who's not pregnant, and seem to be having outcomes that are about the same as somebody who's non-pregnant. So about 85 to 90% have mild to moderate symptoms. So we do know that severe sequelae can happen, but they seem to happen at the same rate, whether you're pregnant or not pregnant.
Yeah. So the best thing is to avoid getting COVID at all. But if you do, young people seem to fare quite well with this. So, and fortunately, we consider pregnant women in that young adult group. There's a question about the babies, if the mother was infected, and I think we've answered that as well, that the chances are that the baby's going to do just fine. Babies.
Yeah. I mean, in fairness, Agnieszka, I think what you've asked is there any cases of complications? And yes, what we're seeing as a general theme is that babies are being born at term and healthy. But that being said, there have been a handful of cases across the world where pregnant women have gotten very sick, and there have been complications for those babies. So we think that the complications for babies is kind of proportional to how sick the mother is.
One of the things that people ask is what do I look for when my baby goes home? And of course, that's something we say to anyone who's had a baby when they take a baby. The best indication of a well baby is the mother's intuition. And so we always recommend that if they have any fear about their baby feeding poorly, looking poorly, not responding well, all of those things are an issue to be seen by a care provider, and not 2 days from now. Those are those issues. And babies and young toddlers have much the same, they have different kinds of symptoms. But if you have a toddler, then you always want to look to see if they have any symptoms of respiratory infection, which is like runny nose and cough and fever. Those are the things that would make you more concerned, and they should be kept away from your baby anyway, no matter what the cause is.
Can I ask you both, have you been changing the way in which you give prenatal care? Have you been doing more virtual care? And how's that been? What's your experience as providers? And I suspect that some of the patients might have some thoughts about that as well, but how has it been working?
Sure. So certainly things are, now that our curve is flattening out in Manitoba, things are starting to feel very much as they did pre-pandemic. But for about the months of April and May, we had several modifications to prenatal care. For low-risk pregnancies, we did space out some appointments in accordance with the World Health Organization's schedule of prenatal visits. And certainly we had physician groups tag teaming together. So if somebody had diabetes and was seeing the endocrinologist, or was being seen in ultrasound for assessment of growth, we were trying to not double see patients, and we were trying to do a blood pressure in ultrasound, which was unusual, but it got the clinical visit done. So we were trying to work as a team. And we've also had some modifications to how we screened for gestational diabetes. Rather than taking that awful sugar drink, we were doing it using a blood test. So those were kind of the large modifications to prenatal care at our center, at least. And I mean, I think that our patients were understanding of why those changes were being made. And in some ways, I think it was very nice to speak to a patient in her home, in her own space. And there was something very personal about it. And I think that there are some aspects of this virtual care that are going to be with us post-pandemic. And that's not a bad thing.
Yeah, I would agree. And Bill, has that been your experience?
Yeah, when this, of course, for a while there, people were very cautious about coming out, and we were doing some of our prenatal visits by phone. I mean, if they've, it's really important to know that the essential part of prenatal care sometimes is that early part of your pregnancy, especially before 12 or 13 weeks, when there are so many things to talk about, but so much of that can be done over the phone. And so, and the only persons that we were seeing in our office was my pregnant patients. All my elderly patients, they weren't coming in because we could deal with them on the phone. So I think we modified it to two ways. We saw people more virtually, and we also saw them more away from other people. And I think that has worked really well. And I think it's going to stay that way for a while.
Yeah. I'm just going to give the last question to Millie. And then Millie asks if there's a higher chance of preterm delivery if you are someone who contracts COVID while pregnant.
That's a great question, Millie. In terms of the themes that we've seen coming out of the literature, certainly delivering early is something that we've seen. The the reports are varied from study to study, and we don't know sometimes whether the preterm birth was because a woman who was infected went into spontaneous preterm labor, or whether it was a decision made by the medical team to initiate the delivery early because of COVID. So I would say that at this point in time, there's certainly a signal that perhaps preterm birth is associated with COVID-19 in pregnancy. But I would also caution that the type of data that we have available to us right now is not the best for ascertaining whether that's accurate of the whole population. So as Dr. Blake or Jenny had said, we have registries going on across the world right now, one in Canada, where we're collecting more systematically data about women who are pregnant and have had COVID during their pregnancy. And that's really going to tell us much more objectively whether COVID-19 during pregnancy is associated with preterm birth. So we still have a lot to learn, and we're going to be following the situation closely and updating as needed on the SOGC website and our resources.
Thank you. I think we're going to have to wrap it up now, but I really want to, first of all, thank everyone who joined us for this Facebook Live event. We were really pleased that so many people could. It's just been a phenomenal response, and you've had really important questions that I'm glad we had a chance to hear them, and that you had a chance to hear each other's questions. We're going to be posting all of these questions, and this event is going to be resident on the SOGC Facebook page, so you'll be able to come back and look at it. I hope you got the message that your pregnancy is something to be happy about, and that we're here to support you, and that everyone is really dedicating themselves to make sure that you and your baby are safe. That we don't have all the answers, but we're doing our best to make sure that we get the best answers that we can. And we're constantly reassessing to say, is there something new that we need to be aware of? So we're just constantly focused on making sure that you're safe. This is the end of our live session, and I really want to take a moment to thank our panelists, Dr. Pollack, Dr. Eamonn, fonts of wisdom and knowledge and good advice. Thank you so much for taking the time this evening. I want to thank Millie for supporting this event. I want to thank First Response, our sponsor, for making it possible and being there for moms. We're going to make sure that we have an answer posted for every question that we have an answer for. And if we don't have an answer for, well, we'll say so, and we'll do our best to get you the best answer that we can. We do have more information on the SOGC.org website, and that just keeps on changing on a daily basis. So please have a look to see what we've got. And thank you once again for joining. Have a great evening and have a healthy and happy pregnancy, and we wish you well.